in the range 0.5 to 1 at the present time, probably somewhere in the middle of that range. And the second thing which I have said is that it is really important we do not go above 1. That one is an absolute target, and the reason for that is that once it goes above 1 for any prolonged period of time, I mean, it might just flick up for a short period, then you go back to exponential growth, and then sooner or later, depending how much above 1 it is, you get back to the situation the NHS is threatened to be overwhelmed, because exponential growth goes from very small numbers to very large numbers very fast. So I would like to clarify that it's not going above 1 is the long-term target. Clearly, the lower we can get it at the moment, the better. But as I say, it's probably in the middle of the range, 0.5 to 1 at the present, and that is bringing down the R, which is what you're actually seeing when you look at the critical care and other metrics we looked at in the slides.
Thanks very much.
Could I just,
yeah, of course.
One extra thing, actually, just on the life insurance, and just to be clear, there's nothing in this life insurance scheme that would waive the rights of the families of individuals who get COVID and either die or are seriously injured from, in a sense, suing the NHS in the traditional way if they feel they haven't been properly protected, particularly in the absence they might feel of appropriate PPE gear. There's no waiving of their standard employment rights involved in any of this.
No. Beth Rigby from Sky.
Thank you. Professor Whitty, at the beginning of the lockdown, Sir Patrick suggested a death toll below 20,000 was a good outcome. Now hospital deaths are sadly above 21,000, and that doesn't even include care home or community deaths. How have you had to change your expectations as the disease has progressed? And can you provide an updated expectation of what you think a more realistic number is now? And Secretary of State, you've promised 100,000 tests by Thursday, and last week you said trace and track was key to easing social distancing measures. What level of testing do you need to get track and trace up and running, and what's your time frame for that?
Yeah, go ahead.
So on the first one, the number will definitely exceed 20,000. So even with hospital deaths, as you say, sadly it has gone above that. Once we look into direct and indirect, and I constantly make this point, but it is really important, direct and indirect deaths all cause mortality. We definitely, sadly, do expect it to exceed that. I think that my view actually is we need to view this epidemic over the long run, and this has got a very long way to run. And I'm really cautious about putting out, and I've said this again repeatedly, these kind of absolute numbers, because this could go in a lot of different ways over the next many months until such time as we have a clear exit that has a vaccine or drugs or some other route that allows us to be able to say, look, we now can stop people dying from this. And this is going to be true, to be clear, in every country around the world. So I'm really cautious about putting these absolute numbers, but I am absolutely clear also that the 20,000 number is not where we will be once we add in the direct and indirect causes both in and out of hospital.
And on the question on test, track and trace, it's all a matter of degree. The lower the number of new cases, the more effective a system of test, track and trace of any scale is. And therefore, 100,000 tests a day is a big enough testing system to start test, track and trace. But if it's bigger, then the system can work on a higher number of cases and be more effective. South Korea is a really good example where they peaked in terms of tests a day at just over 20,000, and they've now brought that down because their number of new cases is so much lower. They can test everywhere they want, and they still don't need to use up all of the tests that they have the capacity for. And we've seen over the last few weeks the gaps between capacity and the number of tests done in this country as well. And I noted, on Sunday, the new German ambassador to the UK was explaining that there's the number of tests, the test capacity in Germany is 800,000 a week, and they use 450,000 of that capacity each week. So we have a similar pattern of the capacity being higher than tests used all around the world, the capacity that we're building is big enough to get started on test, track and trace. We need to get the track and the trace part of that up and running so that they can be effective as we bring the number of new cases down.
And can I just follow up just on one thing, Professor Whitty? Just quickly, what explains the mismatch between where you thought the death toll would be at the beginning of the lockdown and where we are ending up at a month in? What changed over the course of the past few weeks?
I've never put an absolute number into the public domain. I've been asked this lots of times. My aim has always been to try and get the number to be the minimum we can manage. But to be clear, this has got a very long way to run. And I think just thinking about the first peak, which due to the fantastic work the whole nation has done and the work of the NHS, we have actually managed to go through. We've still got some way before it's falling right off, but there is a long, long way to go beyond that. And I think it's a big mistake, in my view, just to consider just the first phase. We need to look at the epidemic as a whole.
Thanks very much, Beth. Gary Gibbon from Channel 4.
Professor Whitty, could I follow up on what Robert Peston was asking about on the infection rates? If we are in the middle of the 0.5 to 1 range, will that do? Is that good enough? Or is it actually the rate that you need to give clearance to a relaxation of the rules is lower than that, is perhaps around 0.5?
Well, I think there are, clearly the lower the R, and just to remind people who don't watch this programme the whole time, this is if R is 1, one person gives it to one person and the disease is stable. If R is 0.5, 10 people give it to 5 and so on, it's going down. And if it's 2, one person gives it to 2, gives it to 4 and so on. That was just a clarification for people watching. The further away the R is from 1 and on the downside, so the closer it is, well, the lower it is, the better, for 2 reasons. The first of which is that it will mean that the peak will fall away faster and will get down to small numbers at a quicker rate. That's a good thing, clearly. But the second thing is the larger the gap between where the R is, the current force of transmission, and 1, the greater room for manoeuvre there is in terms of trying to think through when ministers have to look at things in terms of what could be reintroduced without threatening the risk that we could go back above 1 and start going back to exponential growth. So we know what we've currently measured indirectly, but I think that there's a reasonable degree of confidence that it's in that broader range, 0.5 to 1, and I think it's probably in a rather narrow range in the middle of that. Obviously, if it was lower, that would give us more room for manoeuvre, but it gives some room for manoeuvre, but it doesn't give a huge amount of room for manoeuvre, and that's one of the things that we ministers are going to have to consider, is how to actually make sure we keep the R below 1, given where we are at the moment, thanks to what everybody is doing. But, there isn't a magic number here. Lower is better, but it's not that there is a specific number that has to be the right number.
May I ask a quick supplementary? What's your current estimate of what R0 is measuring in hospitals and care homes?
I think at the moment it's quite difficult, and it's quite difficult to separate those two out. My expectation is that it is very clear it is falling in hospitals. Where it is in terms of care homes, I think, is less easy to work out at this point. We've got ONS data coming out tomorrow, which may help a bit, but we're not measuring that directly, I have to say. And what I think we're seeing across the country is some care homes where there are significant outbreaks and other care homes which are unaffected. They're not it's not like the community are, which is much more heavily influenced by the whole of the population. It's much more local to particular areas and particular care homes.
And maybe Steve could answer on the NHS point.
So in hospitals, it's clear that the number of people who are testing positive in hospitals is falling, and therefore infection rates are falling. We would expect that because we're now in a position where the community spread of the virus is less, and therefore that will translate into lower spread in people coming into hospital and therefore in hospitals as well. As Chris said, I think care homes think differently in terms of the approach to that, but in hospitals it's clear that the infection rate is falling.
Thanks very much, Gary. Sebastian Payne of the FT.
Thank you very much, Mr. Hancock. There were reports over the weekend that in the second phase of fighting the coronavirus, the government is planning to quarantine people arriving in the UK for 14 days. I was wondering what changed your mind about tighter border restrictions, and does that mean you're going to be encouraging British families to holiday at home this year? And if I can ask a question for Professor Whitty, could you give us an update on antibody testing, please, and whether the government has seen any breakthrough in its assessments for those tests?
Thanks very much. On the borders, we've been very clear that we follow the science, and given the current level of infections, level of new cases in the UK, and the very low amounts of international travel that's going on right now, it is clear that the impact on the epidemic as a whole of the number of people coming through the borders as a proportion is very low. But as we bring the number of new cases down in the UK, that proportion coming from those who are travelling internationally will rise. And that means that the judgment on the measures that you need at the border changes. And we've seen a number of countries go through this process, and we'll have more to say about it in due course. On the testing point, I don't know whether you want to go into that, but the antibody tests is still something that we work on. We have now lab-based antibody tests. In fact, in the field now, the Office for National Statistics survey is based on lab-based antibody tests, but we're yet to find what's called a lateral flow, which means a test you can take. You don't need to send the sample to a lab because it gives you the result on the stick. We're yet to find one that has a clinical level of results that we're confident in.
I mean, my view is that science very seldom moves forward by breakthroughs. It moves forward by small incremental changes that over time significantly improve things. That is what I think will happen with this antibody test. We currently have tests that are good enough to give us a first pass at a ranging shot on surveys, to give us a feel for how many people in the community overall may have been infected, some of them without knowing it, because there's certainly some transmission without people actually getting symptoms. But an antibody test that is good enough actually to be able to say to an individual, we're confident either yes, you've had it, or we're confident no, you have not. We have not yet got to that stage, and I think it's unlikely to happen in a single leap. It's likely to happen in a series of small improvements that get us to a point where we feel sufficient confidence we can do that.
Thank you. Mr. Hancock, could I just ask a follow-up, please?
Sure.
You mentioned earlier you were encouraging people that if they've got heart pains or are worried about serious illness to go to hospital. Has the government done any work to measure some of the health side effects of the lockdown, such as its impact on mental health or domestic violence? And will that play any part in your decision on how to ease the lockdown measures? Thank you.
Yes, we have. And one of the striking things around the world is that far fewer people are coming forward to use health services, including here. Far fewer people are coming forward to use non-COVID services in the NHS. I'll ask Professor Powis to elaborate, because he's been doing a lot of the work on this.
Yes, so Secretary of State said, and as Chris said earlier, one of the things that we have concerns around are the indirect deaths, i.e. deaths and harm that is not related specifically to infection with COVID-19. And that's why for some weeks now we've all been reminding everybody that if you do have a condition which might be a heart attack, chest pain, symptoms that might be a stroke, then don't forget that the NHS is still there for you. The emergency services are there and always have been there throughout this. And also these are conditions where it's important not to wait, because treatment, diagnosis and treatment, speed is of the essence, and we can do many things for those conditions now, but we need to do it quickly. So the message to the public is come forward. The NHS is working if you have a sick child, if you have those symptoms. I think in the long term we will only be able to tease this out as we start to look at excess deaths overall. Chris has mentioned that, I think, earlier today. And, of course, comparisons between countries in terms of excess deaths will be important as well. But we do know that attendances in A&E department are down. There's reasons that might be the case, but there are reasons why we want to encourage people to come forward if they have emergency symptoms that might need emergency treatment. So I think it will become clearer over time, but the key message for the public is the NHS is there for you. Come forward as you always would if you've got symptoms or one of your loved ones has got symptoms that might need emergency treatment.
Thanks very much, Seb. Gordon Rayner from The Telegraph.
Thank you, Secretary of State. Professor Whitty, you said in March that children only got mild symptoms of coronavirus, which you said was a silver lining, while Sir Patrick Balance said closing schools would have a minimal effect on the spread of the virus, so it was safe to keep them open, and there was zero chance of children avoiding contact with each other anyway. To what extent has your advice on sending children to school changed? Have you worked out the effect on the R value of sending children back to school? And also, do you believe that children can spread coronavirus to other children, following reports at the weekend that perhaps they couldn't? And just very quickly, Secretary of State, you've just announced good news for a lot of people that hospitals are going to start taking in cancer patients and doing other non-emergency work. Can you give us more detail on that? And would people be watching this be wrong to interpret that as the start of an easing of the lockdown?
Chris, do you want to take the first one, and then I'll ask Steve to comment on it?
So it remains the case that the great majority of children either don't get coronavirus, or if they do, the symptoms are minor. That doesn't mean, sadly, that is absolutely true. There are still a small number of cases, including some very severe cases, but they are relative to adults much less than they're much less than adults. So that remains absolutely the case. So the first reason for not sending children to school, which is it's particularly dangerous for them, that wouldn't be true in the case of coronavirus. Secondly, there is no doubt that they contribute. If you have schools open, it does contribute to increasing the R. So if you close schools, the R goes down. It's part of the collection of things that were done in March to try and pull the R from where it was near 3 to where it is now below 1. It's only one of. If you did it just on its own, it wouldn't be enough. But if you stop doing it, you would actually lose some of the benefit that we've currently got. Now, there is quite a debate at the moment around the world in science. What contribution do children make to the actual spread of this virus between families around the country, wherever we're talking about? And is it different, for example, between young children and older children, which it may be? But unfortunately, we do not yet have direct data that really help us. Remembering that this is a new disease, so we can give a reasonably accurate answer for a disease like flu. We really understand how children help drive flu. We are still really learning on this one. And so whilst I think it remains the case that we think that the contribution of children at school to the spread of this virus is probably less than, for example, for flu, we do think it certainly contributes, and what we're trying to work out is what proportion of the R it contributes, and therefore, if children went back to school, how much closer to 1, and that's in a bad way, would we be, and could it even tip us above 1, and what can we do, if so, to try and minimise that? So it's a very good question to which there is unfortunately not a really clear answer, but we are getting closer, I think, to having a slightly narrower range of uncertainty around this.
Thanks, Chris. On the restoration of the NHS, we've always said throughout that people should come forward for medical treatment. So people's access to the NHS, access to medical treatment, has never been locked down. Indeed, it's one of the 4 reasons that you should leave your house if you need to. And what we can do, though, is because we now have the capacity in the NHS to be able to start reopening some services, we can do that. And I'll ask Steve to answer the question about with more detail, but it will be locally determined according to what capacity there is locally. But our message to people watching this and reading the Daily Telegraph is that the NHS is open and there to help you, as it always is. And so people, if they think they need medical treatment from the NHS, then they should come forward in the first instance by phoning up their GP or going to their GP online, calling 111.
Yes, so as the Secretary of State said, we are now in a position to start undertaking some of the services that we may have had to have stepped down to manage the surge in coronaviruses, or occasionally where services have become disrupted. So, for instance, I know cancer patients, there may be good clinical reasons why treatment might be delayed during a time when there is a lot of circulating virus in the community. And again, as we've both said, emergency services have been there all along, and it's really important that people access them. But I think, to answer your question directly, it's not at all a sign that the lockdown is about to be relaxed. In fact, I think it's the reverse. It's a sign that the lockdown and the measures that have been taken and the fact that everybody's following them has meant that we are now seeing a decline in patients in hospital with COVID-19. And it's exactly that is providing the capacity once again that means that we can get back to restarting services such as elective surgery. So I think the message shouldn't be now is the time to relax. The message should be that by continuing to comply with these instructions, it will continue to help the NHS as we start to get over the peak and the plateaus to a point where we can get much more back to the services that unfortunately we've had to delay over the last few weeks as we've managed this surge.
Can I just ask a quick?
Of course, yeah.
Just on the schools question, I mean, listening to that answer that Professor Whitty gave, a lot of people, I think, listening to this would interpret that as meaning that there still isn't really a plan in place for how schools are going to go back. Would it be wrong to infer that from what you're saying?
Well, Chris, I'll just say, what I'd say is it's still, as we've said over and over again, too early to make decisions on this, and people should follow the social distancing rules of staying at home to protect the NHS and save lives. And in a way, what we've been saying today about the restarting of many of hospital treatments, NHS treatments, and the encouragement of many people to come forward when they haven't been coming forward with non-COVID health problems is all part of protecting the NHS, which has been made possible by the fact that we've flattened the curve thanks to the social distancing measures. So it should be seen in that light and that context. But on the school specifically, Chris, do you want to answer?
So I think, starting with the obvious point that obviously the final decisions will be for ministers, and this is not a scientific decision. But what we can contribute from the science side is to say, well, look, we've got this room for manoeuvre between where the R is now and 1. And there's a lot of things that are contributing, which everyone's doing, to pulling that down. Schools are contributing some of that, and it may be different between different bits of schools. And what we're trying to do, very, very short order, is try and give a kind of feel for what are the combinations of different things which actually still keep the R below 1, which is an absolutely critical thing, but allow opening up of different bits of society and different bits of which schools is 1. But I think the decision about how the different combinations go together, that finally is one for ministers. And I know the Secretary of State would completely agree with that. What we can do is help provide some data to help say, here are some combinations of things we can do. But, and I really want to be clear about this, there is no perfect solution where we're going to end up being able to do all the things that people want and at the same time keep R below 1. So there are going to have to be some very difficult choices between different things, all of which, ideally, all of us would love to open up, but we can't do them all. And therefore, there will have to be some difficult choices, and choices around schools clearly will be one of those.
Is that okay, Gordon?
Yes, thank you.
Great. We've got David Walsh from the Sheffield Star.
Hello, Secretary of State. The Raise the Bar campaign wants to increase the threshold for the £25,000 retail, hospitality and leisure grant from £51,000 raisable value to £150,000. In Sheffield City Centre, this would mean a further 157 businesses could benefit from additional £3.9 million of support. This would save businesses and jobs. Can this be actioned? And a second one for the Secretary of State, please. Sheffield is famous for its independent breweries. It has more per capita than anywhere in the country and was enjoying a golden age prior to the crisis. The government's support grants have bought them time, but with no opening date yet for pubs and bars, their very existence is under threat. To get them back on their feet, will the government cancel beer duty for 6 months when they're allowed to restart operations?
Well, thanks, David. I understand, especially coming from a small business background myself, just how important these questions are to the businesses in the centre of Sheffield and the breweries, which have, as you say, been flourishing right across the country over the past few years, and have obviously been very hard hit by social distancing by its nature, which takes away the ability to go for a pint with friends. So I will take these away and talk to the Chancellor about them. What I would say is his announcement today of 100% guaranteed loans for smaller businesses is another important step in supporting businesses to get through this. We recognise the importance of supporting businesses right across the board, whether they're in a town centre, breweries or others who are badly hit by this. Supporting businesses through it is critical because both the health impact of the measures and the economic impact are both best served by people staying at home, because that saves lives, but we'll also get the rate of transmission down as fast as possible, which will then allow us to get through this as soon as possible. So we want to get through it as soon as possible, and we want to support businesses on the way through. And those two specific ideas, it's tempting to say yes to as Health Secretary, but I think I need to talk to the Chancellor. Thanks very much. Dave West from the HSJ.
Hi, thank you. First question for Mr. Hancock. Could you tell us a bit more about the restoration of services, general planned services in the NHS? There are millions of people on the waiting list for general operations or appointments, hip replacements or cataracts and things. When would you expect, what sort of time frame would you expect that kind of general activity to be getting back to normal? Might it be region by region, and what role do those Nightingale hospitals have to play in that, which you mentioned? And the second question, if I can, for Chris or Stephen. This morning, HSJ revealed the warning to doctors about the small numbers of children who are becoming seriously ill with an unusual set of symptoms, which the experts believe may be an emerging symptom linked to coronavirus. Do you think this may be a new feature of the outbreak, or are you pretty confident that these are simply cases of the small, very small number of serious cases of coronavirus, which we do see in children?
Thank you. I'm very worried about the latter, and we are looking into it closely. I'll ask Steve to answer on that. On the restoration, this will be a locally driven approach, system by system. Of course, the principles are that the most urgent treatment should be brought back first, and also that it needs to be according to the local demands on the system. You know, there's parts of the country where the number of COVID patients as a proportion is much lower than in other parts, and so it has to be locally driven. That means, unfortunately, I can't give you a sort of concrete single number answer to when. And it is gradually over weeks, but starting from tomorrow. Steve.
Yes, thanks, Dave. Yes, so as you've referred to, we have become aware in the last few days of reports of severe illness in children, which might be a Kawasaki-like disease. So Kawasaki disease is a very rare inflammatory condition that occurs in children. The cause is not often known. It can be related to a number of things. So it's only in the last few days, as I say, that we've seen those reports, and I know you You reported that in the Health Service Journal this morning. So both Chris and I are aware of that. We have asked our experts, so I've asked the National Clinical Director for Children and Young People to look into this as a matter of urgency. I know the Secretary of State is concerned, as he said. I know Public Health England are also looking into this. So it's obviously important that when clinicians see these cases and worry that there might be a cluster, that they alert other clinicians so that we can make sure that they are identified if they're occurring elsewhere. And then quite rightly, we ask our experts to look into them and to see whether they can establish any link. We're not sure at the moment. It's really too early to say whether there is a link. But what I should say, as we said already this afternoon, is our advice to parents is that this sort of disease is very, very rare. If you are worried about a child who is becoming sick and not recovering, then do remember to contact 111, talk to your GP, or in an emergency, contact 999, because the emergency services in the NHS are there for sick children, and it's important for this and other conditions, although very rare, I must emphasise rare, that you come forward to seek treatment and diagnosis as quickly as possible.
Thanks, Steve. Chris Whitty.
No, I'm just ready to reinforce what Steve said. This is a very rare situation, but I think it is entirely plausible that this is caused by this virus, at least in some cases, because we know that in adults, who of course have much more disease than children do, the big problems are caused by an inflammatory process, and this looks rather like an inflammatory process, a rather different one. But therefore, given that we've got a new presentation of this at a time with a new disease, the possibility, it's not definite, we need to look for other causes as well, but the possibility that there is a link is certainly plausible. But back to Steve's overriding point, numbers very small. Key thing is, if parents are worried, then phone up and get advice. It's very rare.
Ask a very quick follow-up on the restoration.
Yes.
The NHS needed to free up about 30,000 beds to ensure it was ready to deal with the first peak, and has been able to do so, but has used a lot of capacity and had to rearrange a lot of things. How many is it going to need to keep open in case of a second peak or other returns of the virus? Because that's clearly going to be a big constraining factor, along with the staff who staff the beds, on what it can do back to normal.
Well, one of the principles of the tests we've set before we make any adjustments to the social distancing measures is that we shouldn't risk a second peak. For many, many reasons, the direct impact, of course, but also because a second peak would mean that we would have to halt the restoration of the NHS for non-COVID treatments. And that has an impact itself on the health of the nation, as Chris Whitty first set out several weeks ago, in terms of the indirect death rate. So we've got to make sure that we don't have that second peak. Therefore, the NHS is, of course, making sure that it can reopen where that locally is appropriate, given the local amount of pressure on the system, and also taking into account the Nightingale hospitals. In fact, I'm going to answer a question that was asked previously, but by Beth Rigby, I think, but I didn't answer, which is that the Nightingales are not going to be used for non-coronavirus purposes, because they are precisely set up and designed to deal with people who are intubated and are sedated. But the fact that they're there does help us to restore more of the core NHS and get that going as much as possible. Were you coming in again?
I was just going to say, very finally, would you see them, all the Nightingale hospitals, all 7, or I think it's 7 or 8 now, to be used in that way?
In the first instance, yes, but as we go through this, we always keep things like this open to review, to work out what's the best way to use the resources at the nation's disposal. Steve?
Yes, I think the Nightingales specifically have been a very important part of the flexibility that the NHS has put in place to manage the surge. Remember, it's only a few weeks ago that we were really concerned that we would see a surge in patients, particularly those that needed critical care, that would go beyond even the surge capacity we could put in place in our existing critical care facilities by surging into theatres and recovery areas. So the Nightingales, I think, are real proof that the NHS can be agile and flexible and can change its model of care in a very short period of time. Clearly, we want to keep them there because although the peak is reducing, we still feel that we need to have them there as the insurance policy that for COVID patients. But as we go forward, we will be keeping them under review, as the Secretary of State has said. And of course, we're only into the first week or so of coming off a plateau in a peak. And as you would expect, all that work, again, as the Secretary of State has indicated, is being done at the moment to plan capacity going forward. And the restoration of services is a really important part of that, which I'm absolutely sure will occur hospital by hospital and region by region, because infection rates are a bit different everywhere, and because different organisations have stepped up to manage the surge in slightly different ways. But the key point is that we are now in a position to bring those services increasingly back on stream.
If you'd asked me a month ago, Dave, whether we would be having this discussion now about the restoration of those parts of the NHS that we had to pause in order to put capacity towards treating coronavirus, and the question is, how much NHS capacity do we need to keep in hand in case there's a second outbreak, which we don't want to risk. I would be, that I would, and that the NHS had not, in the meantime, been at all overtopped by demand in any instance. Then I think we'd be. If you told me that a month ago, I would be very pleased with where we've come to on the NHS capacity, because that is absolutely core to the principles of this country, is that if you need NHS treatment, then you get it, and we've managed to keep that principle throughout this vast crisis. Okay, thank you very much indeed. That concludes our Downing Street briefing for today.